Good morning, Michelle.
Good morning, everyone. Give everybody a moment to get logged on and placed in the chat box with your facility name and the individuals who are participating today. And if you do have any, there may be some new nursing assistants on for the first time. Please let me know if there's a new nursing assistant in your group today. We're getting lots of folks up and running today. I hope the sun is shining as beautifully where you are as it is here in Baltimore today. It's time. We all deserve that. And I see that Karen Vleck is on, who is assisting us administratively with our registrations. Karen, do you have any announcements? And we'll give one more minute and then we'll get started. Okay, looks like we've got a good group. We have 38 individuals or 38 different email accounts on with multiple people on several. So I'm going to begin by sharing my screen. And give me 1 second. Down and bring up our PowerPoint for today. All right, so today's session is on the role of the certified nursing assistant. Our speakers today are myself and Dr. Boguslavsky. Also, I'm expecting Jane Marks, who's a nurse educator here at Johns Hopkins, to join us. I don't see that Jane has joined us yet, but hopefully she will be joining us. Today, we're wanting to be certain if there are any new certified nursing assistants on the call. If anyone would like to unmute, let us know if there are. And not hearing any, we'll do a literature review, and then we'll go into breakout groups like we did last week. But instead of each breakout group addressing the same multiple questions, we'll have 3 breakout groups that will each address a different area of the role of CNA in managing COVID-19, and then also talk a little bit amongst yourselves about the role of the CNA in quality improvement, particularly regarding COVID-19 management, prevention, management, recovery, wellness for staff, all those topics. And then we'll come back together and then each group will report out. Now, unlike last week, your corporate leadership will not be in the individual breakout groups. And instead, each breakout group amongst yourselves will need to identify a main speaker to report out to the entire group, but anyone in the group is welcome to share comments as we go through each of the breakout session questions. And then at the end, Dr. Boguslavsky has about a 10-minute presentation with a new technique for quality improvement, but using this topic of the role of the CNA in COVID management to illustrate the use of quality improvement techniques. And next week's session will be on the topic of managing social isolation. So with that, I'm going to start with the literature review. And Jane Marks, in her role as a nurse educator, shared this article with me, which was a review of the medical literature in 2017 of the role of nursing and nursing assistants in quality improvement projects within nursing homes. And this was a literature review that looked at the topic, any articles in these known databases of published medical literature. And from this systematic review came 5 articles, and they highlighted that, with our number of nursing home residents and the age of our nursing home residents, and the fact that the majority of the care is provided by our CNAs with our nurses, how important it is that we include nurses and CNAs in quality improvement projects. So they started out with 179 studies to review, but of those, only 51 included nurses and CNAs, and really only 5 studies met their full criteria to be considered the best of the best and to report on quality improvement using nurses and CNAs in the quality improvement processes. And the topics were very common topics in nursing home care: fall prevention and pressure ulcer prevention, managing pain, managing heart failure, and then addressing our multiple quality indicators that we all know are reported in CMS.gov as quality within nursing homes. And the study this review of these 5 studies came up with several key take-home messages from this review. One is that the role of the CNA is very valuable in being champions for quality improvement within the nursing home. Not surprising, given that the majority of care is provided by the CNA, and being part of that, understanding the data, understanding the process for improvement leads to better clinical outcomes. And it also has been shown to increase not only the clinical care of our residents in nursing homes, but also improves job satisfaction, quality of life for our nursing assistants, who, again, are the major drivers of care in nursing facilities. And identifying these champions is a key factor in success of quality improvement initiatives. Also highlighted the importance of leadership of the facility, director of nursing, administrator, medical director, working with the CNA champions and nursing champions in quality improvement processes. So having that team approach that crosses all disciplines and affects all aspects of care are the keys to successful quality improvement, and including the CNA in all of this. So with that literature review, we're going to go now to our breakout sessions. So there will be 3 breakout groups, and I will put these questions in the chat box and in the, let me get back there. Let me just get out of the slideshow so that I can copy these. So group 1.
Michelle,
Yes.
I'm sorry to interrupt. I have a couple of team members in the same office on this call. When we break out, is it possible that Lily Hoffman and Johanna Applegate could be in the same group? Because talking in different rooms was really challenging last time.
Sure, because you're in the same room? Okay.
Yeah, it's also Christine Frazier.
Okay, give me the names again, please. Lily?
Yep, Lily Hoffman, Christine Frazier, and Johanna Applegate.
Got it.
Thank you so much.
Sure. Okay. So these are the questions. Group 1, and the groups are actually numbered, but if you can't see them, I'll come in and and make sure you know which is your question. But the first group will be the role of the CNA in preventing the spread of COVID-19 in the facility. So it is actually addressing prevention of COVID. The role of the CNA and how CNAs are effective in preventing the spread. And working with your facility and understanding the data of spread, how that information is disseminated to your CNAs, how they know about facility spread, and how they can make a difference in preventing it, reducing it. The second group will be looking at recovery from COVID illness, the role of the CNA in assisting your residents who have had COVID in recovering from their illness. And think about all aspects of care and recovery in your group. The third group will be looking at the role of the CNA in supporting family members through the pandemic. Now, last week we had a lively discussion about visitation, in-person visitation, but think beyond in-person visitation. I know we've been supporting our family members for this now year of COVID. What's been effective, what's been challenging, and have there been any quality improvement projects related to this? And then all three groups, as you're thinking about your topic, will then also embrace the concept of including CNA and quality improvement projects related to all aspects of COVID care. So we want to focus in on quality improvement and CNAs in the quality improvement process for your facilities. Okay, so I'm going to copy this. I'm going to stop sharing my screen. I'm going to now assign the breakout groups. If I don't get the three of you in the first time, I can then change your groups. So just bear with me for a moment so that I make sure that we, so I'm actually going to assign them automatically because it does make it go faster, but then I will go in and reassign, okay? So let me now go ahead and create these groups, but again, then I will do some reassignment. So just bear with me, okay? Here we go. Good afternoon, group three.
Good afternoon.
You will be discussing the role of the family through the pandemic. Okay,
Yes.
all righty. And then also considering quality improvement. Okay, I'm going to go to the other groups for now. Okay, and we'll bring you all back in about 10 minutes. Okay.
Sounds good. Thank you.
Mm-hmm.
So it's already up.
To include some of those things.
Good afternoon, group two. I just wanted to be sure you know that you're addressing the recovery of COVID for your residents. Okay.
The role of the CNA and I joined right when you were doing the.
That's right. And I was actually going to be taking you out, but I believe you can you move yourself in and out, Adam, or do I need to do that for you?
Yeah, I can move in and out.
Okay.
So I'm supposed to let them do
Yeah.
it?
You are not
Okay.
running this. You are officially excused from running this session. So let's let this team do their great work and you get to sit back and enjoy. Now, Joanna, was I supposed to move you to 3? Yeah, I thought I did. Let me go back and do it again. Okay. Sorry. Give me a second.
If Mike
if Mike Furline is in the group 3, switch him over to group 2.
Okay. Done.
Thank you.
Mhm.
Hey, Mike. All right.
Discussion.
Hello, group 1.
Oh,
Let me
hello.
know that you are addressing the role of the CNA in preventing spread of COVID in your facility, as well as discussing the role of the CNA in quality improvement projects related to COVID. Are you all set for that?
Yes.
Okay, and let me see who's in your group here. And Victor is not running this group. We want the group to identify a leader within your session. There's Jane Marks. Hi, Jane. We've
Sorry, it was,
no problem. We've in our breakout groups. This group is going to be addressing the role of the CNA in preventing the spread of COVID-19 and addressing in general then COVID-19 quality improvement. Victor and Jane might float from session to session or stay within the session, but looking for a wonderful representative from Genesis to be the spokesperson for this session. So with that, I'll leave you to your great work and I'll call you all back together for a discussion in about 10 minutes. Okay?
Okay, sounds good.
Complaints. And a lot of them are centering around just being able, I think the frustration, accumulation of not able to physically touch or see their family member readily. It's just, it's been a long time. This is over a year, going over a year now. So we're trying to do things to mitigate that with Zoom calls, phone calls, but nothing replaces human touch.
Hey, can you guys hear me?
Yep.
Hey, I'm an aide at Edge Hill Nursing Home. I think the biggest challenge was just trying to get like the residents to understand that, there was like a pandemic going on and like, we're not allowed to have their families come inside and stuff like that or like see them. And honestly, it is a challenge and it still is a challenge because they're like, oh, why doesn't my daughter love me? Or why doesn't she want to speak to me? Or why does my son, why he's out there, why he don't come inside? We're trying to get them, even with the Zoom calls, they're like, oh, why are you there? And why are you not over here? Why can't you, you know what I mean? Even when they go see even when they see their grandkids and stuff like that. So I think the biggest challenge is trying to get them to understand that it's for their safety, not only our safety, and then the family safety and stuff like that.
Good point.
Yeah, I agree. That was very well said. I mean, I think a lot of times we take for granted that, we have this constant source of information from our respective organizations and, policy changes and what's going on in the community. Whereas our residents don't necessarily have that. They might watch the news, but they might not have the capacity to really understand. So where I think we come in and where our CNAs and our nursing staff, et cetera, really can take a role is, trying to help them to grasp that. You mentioned, they do a Zoom call, but they want to know, oh, well, why aren't you coming in to visit me? Well, they might know that there's a COVID, outbreak going on, and that's why we can't have folks coming in to visit you, but they don't really understand what that means. And I think that being that the CNAs are the frontline staff of our, facilities, it's really imperative that they are able to connect and able to communicate effectively with the residents, helping them to understand exactly what may be going on, keeping them abreast of new policy changes, updates and things, making sure that they are able to maximize their experience.
that's the same. Yeah, we're pretty much doing the same thing here in Bridgeville as well.
A lot of the CNA involvement when it comes to our copy is actually like running our ideas by them. Like we might meet and they might not be at the actual meeting itself where we're starting to get the ideas, But when we want to roll something out on the floor, it's like, what do you think? Is this actually realistic? Like, do you think this is good? What's your feedback? And then we'll take their feedback back to the team to reevaluate what we think we're going to do. Because a lot of times if you're a manager, you think something's realistic, but then you talk to the CNAs and they're like, no, that's not realistic. And then you have to go back to the drawing board a little bit to figure out what makes sense.
Absolutely. Well, when we get pulled back into the big meeting, maybe we can just, kind of touch base on those indirect supports that we were talking about with our families. And then Johanna, maybe if you want, you can touch base on the quality aspect of that question when we get pulled back in. Anything else anybody wants to add to either of those topics?
I think you have it covered.
Okay.
I talked last week, so I'm not talking.
My office is in agreement.
I feel like me and Johanna did a lot of talking last week too.
Well, yeah.
Never mind.
Now, there's no limit to how much talking you can do. And it's so much better if you talk than if I talk. No, all joking aside, I appreciate we've been talking about all these issues for our 13 weeks together. So I do appreciate that. Since you've done such an efficient job here, let me just ask this small group, are there any areas of COVID care that are not in the curriculum or something you'd say, gee, I wish we would spend some time on this, just as some informal feedback since you've already done your assignment? No.
Like I think what I'm most personally curious about with COVID is like, what's the future going to look like? Like what's coming now that like you said, like families last week being vaccinated, what's that going to look like in our policies moving forward? And, residents too, that are vaccinated want more freedom, and how is that going to happen? And how can we do that and safely do that? How are we going to discriminate or like not discriminate, but determine like who's been vaccinated, who's not been vaccinated? Are they going to have different policies? Like, what does that all mean in a working practice? That I think we're very curious about. We would love to have our families members have more freedom to come in. It would free up a lot of our recreation staff or staff running visits to focus on other areas that, they've had to realign, and I think it is such a different feeling in the building when you have families in, and there's things we're probably not seeing. Like when you come visit your loved one, you're going to see the little things that maybe we are missing, like hey, someone's picture fell off the wall behind the bed and maybe we didn't notice it was there. I don't know, probably they would when they clean the room, but just like little things that just as a caretaker you try, but when it's a family member, you are going to see things in a different way. And
I think we've definitely recognized over the last year, like the support, I guess we didn't realize from the families there every day, for those little things. It's a really good point.
Yeah. Next week topic is social isolation.
Managing the social isolation. I pulled out that curriculum and I was looking at it, but I feel like just how those policies are going to evolve. I mean, that might be a week session 16 talk, but because it's still the future yet, but that's really where we're curious how things are going to.
Well, that's where the challenge is, because we're getting things, from the CDC that are kind of loosening restrictions on employees. But that same guidance isn't being applied to residents. One example is if an employee has prolonged exposure to somebody who has COVID and they've been vaccinated, they don't have to quarantine. But if I have a resident who's been vaccinated and has been exposed to an employee who tests positive for COVID, they still get quarantined. And, we have to, and that's where we're getting challenges from, people are starting to bring this up and kind of like putting those things together. And I think, as Joanna kind of mentioned, that's the next evolution is, what are going to be some of those exceptions or one-off rules?
And I will say that changes in policies are coming. Unfortunately, I think people are a little ahead of the data in terms of the number of cases, the number of deaths. we're still higher deaths today than we were back in the peak last spring, but we've come down dramatically from where we were in January. But it's a perspective. But we anticipate continuing to drop below where we were at the beginning of the pandemic as more individuals are vaccinated. And those who, even if they have COVID, it's a much less severe illness, not hospitalizations, not stressing the healthcare system with ICU beds. And so policies will change, but as soon as people are vaccinated, they're feeling like they need to change now, as opposed to what are the data and how are we making these policies. And I think educating all the staff on, well, why aren't we open today, helps them understand that things will change and here are the criteria for changing. But yeah, people want it now. And so it's challenging for those of us in the field. All right, I'm going to check on the other two groups, and if they're ready, we're going to bring everybody back together. But thank you for sharing that. As I meet with your corporate leadership tomorrow, I'll be able to share that that's an interest for the group, and we'll be sure and get that, have discussions. Okay, great. All right, see you shortly.
Percentage of the community spread, and that's a great idea.
That's how we also communicated our to vaccine. So we communicated like, travel restrictions when we had those in place to remind staff of, not being able to travel, how to prevent community spread. When we were doing immunizations, we still do them, even though we're out of outbreak. We do them once a week now. We actually had one this morning. So
it's a nice way to share that education, to get them to be able to then hopefully, educate other people in their family as well.
Is this group ready to report out? Yes? Okay, let me bring everybody back together. All right, everybody's coming back together, and that'll finish within the next minute. While we're waiting, Group 3 shared with me their interests in future sessions discussing changes in policies and how we'll best readjust as we have more changes in policies with respect to visitation, with changes in quarantines, as we have more individuals who are vaccinated. We had a little discussion about how staff no longer must quarantine if they've been vaccinated and have an exposure. However, residents must be quarantined. So we had some of those discussions about changes, understanding changes, and disseminating changes in policies and practices. So that was a good discussion. I think everybody's back now. So I'm going to ask our Group 1 that was discussing the role of the CNA in prevention of COVID-19 in the facility to begin that discussion. Thank you so much.
Hi, my name's Tara. I'm from Group 1. What we talked about is obviously involving the CNA in the QAPI process, helping us facilitate processes while educating them what's the best way to meet our goal with infection control and spreading COVID. Someone actually in the group too brought up, which I love this idea. One of the question is how to not only prevent spread in the nursing facility, but how to prevent spread within the community as well, and education upon that once you leave our doors. And their administrator actually does a weekly Zoom call for all staff members to join. And then she or he does education about what's going on in the community, what's going on with Genesis, how to prevent spread, not only in our doors, but outside in the community. And I thought that was a good way to touch everybody in the building and offer an option to get information and to be able to ask questions. I really like that idea.
Terrific, thank you. Any other members of Group 1 who want to add to the discussion?
Yeah, I mean, I think Tara did a really good job at explaining everything. And yeah, that's, you know, the CNAs are really the most critical link that we have in the QAPI process, and, you know, making sure we include them, you know, if we're thinking of starting a new process or if a process is already started, to get their feedback. Because a lot of times they'll be able to say, well, the trash bags where they're located isn't working. If they're located here, you know, it'd be a lot more feasible just in workflow and the process. So, yeah.
Matt, what are the effective ways for the CNAs to give that feedback?
So we do daily huddles for every shift. So where they're talking to the unit managers and the supervisors as well, just to make sure that they're included. And obviously, you know, department managers are rounding on the floors every day and stopping and talking to staff about how is it going, what's going well, what needs to be improved upon. And so it's an always open door communication process.
But identified strategies such as your team huddles, your leadership rounding, both effective tools for obtaining feedback on a quality improvement process, and ones we've talked about in our quality improvement sessions. So thank you for sharing that. Any more discussion on prevention of COVID by our wonderful Group 1? And Jane, I think you were in that session. Any thoughts in your educator role?
No, I wasn't there. I think they all had some great ideas of involving the, you know, the nursing assistants in identifying issues and then, you know, working with them, as much as the huddles that they described, as well as someone mentioned, the administrative person does kind of rounds to kind of gently just reinforce things and to, you know, answer questions physically, which I thought was a nice idea as well. And then just making things, you know, available in regards to maintaining safety. And then we opened the discussion about the outside safety. How can we promote safety, you know, outside of the long-term care facility to make sure that we're being safe when we come into work. So I think everyone shared a lot of good ideas and work that they're doing to involve the nursing assistants.
All right, Group 2, you were discussing the role of the CNA in recovery for your residents with COVID-19, as well as the quality improvement engagement of CNAs. So who's reporting out for Group 2? Someone on mute that needs to unmute?
I guess it's me.
Okay.
So we had a nice discussion. We actually had the pleasure of having one of our CNAs from one of our sister facilities in the group. Noel, I believe is his name. Brought up a lot of really good points. I mean, we deal with this reality every day. We get to leave at the end of the day. We go home, we see our loved ones. We, you know, get to leave the facility, leave the confines of that room. We got to remember that these residents, they don't necessarily get to leave the confines of their rooms. And if they do, it's to go to a structured group activity with a social distancing and all the bells and whistles that go along with that. And just trying to keep that in mind with our residents, you know, both alert and not alert. You know, I think Noel was saying that there's you know, they're doing their Zoom calls, their Zoom meetings with families. And a lot of times the residents are confused or asking, well, you know, why are you on the computer and not here in the facility? And trying to get that grasp of information to them, explaining to them and helping them to understand what exactly is going on in the world. And taking that extra time, you know, things right now are not the same as they were a year and a half ago. I mean, they're very different. How we relay information to our residents and how we, you know, kind of how they process that information, and then how we react to the way they process it, that information. I think it's really important, especially with CNAs. They're typically they're frontline workers. They're in every room every day, multiple times a day. They know our residents the best. I think it's really important that everybody keeps that in mind. Michelle, you're on mute.
How about now? Can you, okay. Noel, are you able to unmute your microphone and share some of your experiences in COVID care?
He might not be able to unmute right now, but I have the pleasure of working with Noel every day. And so we here at Edge Hill appreciate the time that he takes and the time that the other staff members take to, it is difficult because, again, we are able to leave the building. And so we also have to be conscientious and mindful of, how we react to what they say and take a moment to kind of appreciate and be empathetic and, do the best that we can to kind of help in this whole process. Being the extra ear to listen to sometimes, bringing something in it, that they like, because they may not even have that family support where, they have family members bringing something in. So I think the staff, in a lot of facilities, they work really well with the residents because they do have that empathy. And it is a difficult situation, not just for the residents, but for the families also. So, I appreciate all of our aides who take that extra time to sit and listen and, give care and show love, because that's basically what it is.
Mm-hmm.
So thank you, Noel. We appreciate you.
Wonderful. Thank you. So this theme also arose in our Tuesday session. So we do our great personal care, we're doing our nutrition, we're monitoring vital signs, but it's that personal touch, that compassion that our nursing assistants and that time and listening that we don't learn in textbooks, but in fact can make the biggest difference in the care of the residents we're serving, and taking a moment to acknowledge that, and as a team to celebrate the CNA and that role. So absolutely. Thank you, Kelly, for sharing the perspective. Any other discussion from group 2? Anyone else want to share some of the discussion with respect to recovery? And I saw in the news last night that $1.5 billion is being devoted to research in COVID recovery right now through the NIH. So we're all hopefully going to learn some more, and that will help us in our practices, whether it's nursing home recovery from COVID or community, our own staff recovery. So certainly an area with new opportunities to advance care. Okay, how about our group 3 and talking about the role of the CNA and supporting families?
So we kind of scratched our heads for a minute thinking about that one, because we came to the realization that over this last year, our CNAs probably have not had a lot of direct contact with these families. Being that the families are not coming in. I think somebody had mentioned, maybe some interaction during some facilitation of window visitations if the CNA is around. But then we started talking about all the support our CNAs indirectly give to the families. And I think the biggest topic that we kind of landed on was that during this past year, our CNAs have been our residents' families. So, giving that support to these residents every day, just being there for them, has been a huge support and a huge appreciation. And this has been verbalized through a lot of our families because they can't be here. So we are. And the CNAs play the biggest role in that, just caring for them every day. Then, talking about indirect support to the families, when the families are calling in for information, they want to know how they're doing, not that the nurses are aware, the nurses are taking care of these people too, but the nurses may ask, how's Mrs. Smith today? How'd she do when she got up? The CNAs know that. So the CNAs are providing this very valuable information to our nurses to be able to report back to these families so that they know how their loved ones are doing. I think that, the indirect support has been amazing from the CNAs.
Thank you. Thank you. What else in group 3? Anyone else want to add to that
I
discussion?
was gonna talk about the CNA involvement in QI.
Great. Thank you, Joanna.
Yeah. So I mean, it wasn't just QI in my mind for infection control, but that's certainly part of it. But any quality improvement project in your facility, if it's a facility related improvement project, it really needs to involve your CNAs on some level. They are the first line for a reason. They're the ones engaging with your residents one-on-one. So while it's not always feasible to pull them off the floor, anything that we're developing is something that when we're gonna, plan, do, study, act, we can start that plan and, come up with an idea, but until we're not going to put it in action until we talk to the CNAs and say, is this realistic? Like, we think it's great, but is it? Because if you don't actually ask that question, you're wasting a lot of time, because they can tell you right away, yeah, that's not realistic. And it's not realistic because of this. If they could when they can get to the planning meetings, that cuts down on time, but it's not always feasible for a CNA's workflow to get off the floor. So, I mean, we can do little check-ins, but for the most part, they have to be somewhere in that quality improvement process because they're a big hinge in this building. And sometimes they can go, I have customer excellence, and they come, if I can pull a short stay CNA to come to a quick customer excellence meeting to talk about their perception of what's going on with our short stay population, that's really valuable information, because there's not a lot of departments at one time in their admission observation units because of the flow of the building. So the CNAs are spending their entire days with them, and they get the biggest window of time. So it's leveraging their expertise, but they're definitely a big part of this building and the way the operations work.
So you've identified a challenge in CNA participation in QI, and that's the time factor, but you've also shared with us some mitigating strategies, such as on the floor, asking directly, and finding some short meetings that they can attend to be with that multidisciplinary team in preparing a QI project and giving feedback on a project. So thank you for sharing that, Joanna. Okay. All right, I'm going to share my screen, and at this time, Dr. Victor Boguslavsky, for our IHI quality improvement expert, is going to use this topic and demonstrate QI process that we hadn't talked about before. So let me get to his presentation, and we'll begin right there.
Great, thank you, Michelle. Thank you, everyone. Again, I have learned a lot, actually. I'll present briefly about the driver's diagram as one of the QI tools. But before that, I'd like to say that it's just sort of wonderful to be in this, even in one group discussion, but also hear your feedback about the ideas and change ideas that come and logically sort of fit into this thinking that I had in mind for putting this slides together. So I wanted to present briefly one tool that is called the driver diagram. If you go to the next slide. And again, the driver diagram, or sometimes called the tree diagram or systematic diagram, is really a useful tool to develop a structure for a quality improvement project by establishing an aim or a vision, identifying primary drivers that often we also see as strategies, secondary level drivers, more like interventions, and if implemented together could certainly help achieve the stated aim. But also within the, as you can see on this little sort of picture, you can see that in addition to that within each of the drivers or interventions, you can think about some sort of more specific changes or activities, changes we call them, that could be planned and tested over time through PDSAs. And that's sort of basically the approach that sort of helps you to develop more your learning framework for the quality improvement activity or for any activity with the quality improvement in scope, and helps you to adapt, adjust as you move along towards achieving the aim. So on the next slide, I wanted to kind of demonstrate how I thought I would just apply the this kind of driver diagram thinking to for this specific topic of today's set of session. And I put the aims such as achieving the effective role of CNAs in managing and supporting residents and family members during the COVID-19 pandemic. So then I thought about key sort of drivers of strategies. They shouldn't be many. So I thought of 4 that would, that would sort of, again, put together that would logically contribute to the aim. So I thought about the securing leadership and management support, obviously improving competence and skills in the provision of the care for residents, and we talked about this already. And then enhancing the professional development of CNNs through the participation in quality improvement activities and ongoing learning, and obviously the safe environment and operations. Those are 4 sort of drivers that I thought I would put together. Again, those are actually based off the literature that was presented, and materials presented for this session, but also some additional reading that I had, and also partially, in some way confirms that's a lot of the thinking that we just discussed now. So if you look at the secondary level drivers, the more like interventions that sort of go along each of those primary drivers, and that can go more in terms of under the leadership and management support that would go into the ensuring that roles and responsibilities are defined, and then professional development goals and objectives are assisted, for the TNAs. Then staff performance evaluations, appraisal is done, and they are recognized. And also they have obviously access to the corporate policies and updated infection control and procedures, as well as federal and state guidelines. That on the knowledge side, obviously they need to be up to date, and we already talked about this. The knowledge needs to be up to date, regularly assessed, monitored. If necessary, pre-education or additional training needs to be given, one-on-one support by their supervisors. But also about the documentations, instructions, forms, checklists, need to be provided to guide their documentation about their communication with families, with residents, about their goals and health status and wishes, preferences, etc. And also the documentation that is important piece of the performance, right? To make sure that those documentations are timely made, observations are documented, but also made accessible by the care teams. And also on the quality side, we already talked about is engaging. I like Joanna's point about the engaging them into the multidisciplinary care teams to any activity, quality improvement activity that relates to the larger set of aims of the facility, and they need to be an essential member of the multidisciplinary teams and can contribute to the discussions because they're frontline sort of knowledge presenters, right? So they would be essential members of those. And also, we talked, I thought about documentation of their work through some regular chart audits, that to make sure that documentation is in place, because that's how we know about and timely know about the any change in conditions of our sort of residents. We talked about them attending the morning meetings, rounds, huddles. They need to be essential sort of participants of those. And obviously, the ensuring the safe environment and operations. We ensure that there is a dedicated space for their safety. They practice self-care. Someone mentioned about group exercises. They use properly PPEs and tested. Seems like that's not an issue anymore, and maybe this was at the beginning. And obviously, practice hand hygiene and the infection control sort of measures, including use of disinfectants and work. Again, those are the sort of primary, secondary level drivers. But if you think further, that might help you to think about planning for any changes over time as you design your quality improvement activity with a set aim and then plan to implement over time. let me just stop here if you have any questions, comments. But thank you so much. It was a great learning from you as well. Michelle, I cannot hear you. I think you're mute.
Sorry, there we go. Sorry about that. How about the group? Jane, let me start with you in terms of sharing your thoughts about quality improvement and CNAs.
Well, I like the model that was described. I think that's nice in regards to building up that role of the CNA, especially during COVID. I think Joanna talked about the Plan, Do, Study, Act, and so did Victor mention that as well in regards to his model, which I think is often helpful in looking at identifying a project. And I think Joanna brought up a great point, is getting that early buy-in from the nursing assistant to understand what they think is going to be successful. Or, you know, you may think, oh, this is a great idea, but you know, that's not going to work, you know, when you chat with them. So I think having their buy-in and then planning something, a pilot, so that you can reevaluate and make adjustments as accordingly. But I think they flow nicely with the model that was shown, because it certainly then that builds up the nursing assistant's competency as well. So I think together they go nicely hand in hand.
Yeah, thank you. Thank you. All right. Any other comments from the group? Erin, I just want to make sure you have an opportunity to speak as our corporate leader on the call, or Adam, anything you wanted to add?
Thanks, Dr. Bellatoni. I just wanted to add, to remind the folks on the line that, you know, we pay our CNAs for time on the floor, but I think it's a real good point of discussion to make sure that we provide paid time if they're going into those meetings. So I hear the struggles of having CNAs being pulled from the floor to attend these important meetings. But I challenge you to talk to your RVPs to see if we could pay CNAs, you know, 1 or 2 a month for that maybe hour that they could participate when they're not scheduled on the floor. I think there would be more, it would be a little bit meaningful, because we would acknowledge on a higher level that, you know, they're busy on the floor, and you've made all great points. And I'm so glad that we're involving our CNAs. But I think we could maybe challenge ourselves to think ahead and maybe schedule some time off the floor for them. Like I said, obviously we wouldn't be able to do it, you know, on a large scale, but for sure 1 or 2 a month if we're inviting them to a QAPI meeting. And in fact, CNA attendance is a mandatory requirement in the Genesis QAPI format. So I would challenge you to see if you could schedule some time into those meetings. For our CNAs, because as we all have heard today, they are the crucial link to almost everything in our buildings. So I think it's great. I am so proud of how you spoke about how we integrate them already, but I think that maybe if we move that a step forward and try to get them some time scheduled off the unit to come to these meetings. I think it would further let them know how we value their input.
And in a formal way as well.
Yes. Mm-hmm.
So it isn't on the fly while you're multitasking, but it's, we have dedicated time for your participation because it's valued and it's effective. So thank you. Yep. I put you on the spot and you came through, as always. Thank you. Thank you. All right. Any last comments on the role of the CNA and particularly with respect to quality improvement during this time of COVID care? All right, hearing none, next week will be the topic of social isolation. I'll be meeting with your corporate leadership tomorrow so that we do effectively plan for how we'll do that discussion and didactics and quality improvement. But certainly if you have any suggestions on how to approach this topic, please share that with your leadership. And so we can be as effective in our hour together as we possibly can. And with that, I'll say thank you in the chat box. I see from Noel Santiago saying, keep up the good work, guys. And I'm going to agree with that as well. And with that, Jane, I just so value and respect your nursing leadership and education. Any last words you want to share with us while we got you together?
Can I share my one screen? I always forget to send that to you.
Yes. And I need to allow you to do so, right?
Thank you.
And multiple participants.
I'll have to send it to you.
Okay, but you're able to share. There you go.
I just wanted to let everyone know that as part of our Maryland Gerontological Nurse Group, which we've been around for about 20 years, we've taken a lot of initiative to recognize nursing assistants, especially in long-term care facilities. For the last 20 years, we've done the Maryland Caring Hands Award, which recognizes an outstanding nursing assistant nominated by someone they work with or a family member. And we're excited to continue that throughout this year. We had our winner was from a future care facility. And not only are they given an award, they're given a monetary award of $1,000 to do what they want. And it's just been heartwarming to watch that. We also have taken some initiatives this year to go. We were at a nonprofit facility, which we handed out over 100 thank you bags and made signs and had television coverage just to bring recognition to our nursing assistants. Because I think, as all of you have said, they are the family and friends to our residents during this COVID time. And so we wanted to bring recognition to them, and we're continuing our efforts. And certainly I'll give you my email if you have any questions. I'd be glad to answer them, but this is just some of the work we're doing in Maryland.
Great. Thank you, Jane. And let me ask, is there a comparable organization in Pennsylvania? All the facilities on today's call are from Pennsylvania. Are you aware of a similar organization in Pennsylvania?
So I'm not sure if they have a gerontological nurse group as ours, but GAPNA is a geriatric advanced practice nursing group that is throughout the country, and they have local chapters. So I would certainly, reach out to them to see what they're doing.
Mm-hmm.
Group was a part of the National Gerontological Nursing Association, which unfortunately decided to disperse. And so, but we kept up our chapter. We felt strongly about what we were doing in regards to educating nursing assistants as well as nurses about caring for older adults. And so we've been proud to continue that effort. So, and if not, it's always willing to start up. If you want information, call me.
Good. Any of our nurses on the call aware of a Pennsylvania organization specific to gerontological nursing? Okay, there's an opportunity. Okay. All right, with that, next week, social isolation. Again, if you have some thoughts on how we might work this session, doesn't have to be the same format, but our goal is to get as much out of it as we can in our hour together. And with that, I'll ask everyone to be safe and to be happy and healthy, and we'll see you next week. And thanks very much, Jane, for your words of wisdom and your years of leadership. And Victor.
Sorry, I got on late. I had technical problems.
No problem. Sorry. We're all learning. And Victor, thank you for sharing your expertise with quality improvement and making it very specific to this topic. So with that, I'll say goodbye. Have a nice lunch. Take care.
Thank you.
Bye-bye now.
Bye.